Well, once again, here we are welcoming back our Chief Clinical Editor and Technology Editor, Dr. John Flucke. Dr. Flucke, thanks for joining us.
Thank you. No, it's always fun to get together. So thanks for having me.
So we talked about a month ago, right after the ADA and CDC asked dental practices to forego everything but emergency appointments. What's this past month been like for you at your practice?
It's been a lesson in strangeness. I did stay open for emergencies, and I chose not to work with an assistant because some of my assistants were concerned about the infection. And the more I thought about it, the more I thought it just wasn't worth the risk of bringing even more people into the field of, taking a chance on infecting. So I've been working by myself on Mondays and Thursdays. And I mean, it's been very slow. Our production is down, 90% easily. And I've had one person employed throughout this time who has come in about a half day every day to answer the phones. And that's been about it. It's been very odd.
Mhm. Now, I know you're planning to get your practice back open for regular
Mhm.
appointments in just a couple of weeks. What,
Yes.
obviously, other than lifting of the regulations requiring only emergency procedures as part of this, but what's driving your decision to get back there and see patients and, provide all of the types of care that you've been providing before the pandemic hit?
Well, I think we have more science now than we had in the beginning, which is terrific. We didn't really have much at all, and it's not like we've got a tremendous amount now, but we've got more than we did. And we also, have got things in the supply chain now that are starting to function. So before we couldn't get personal protective equipment, or you could only get it in very limited amounts. And that is starting to change. So I feel better about the safety of my team and the safety of my patients opening now. And then the other part of it too is simply that you can only put off dentistry for so long. I mean, there are people that are in sort of holding patterns, as you will, that can't afford to be in holding patterns, forever, and they need to be treated. And so those folks need appointments, and that's what we're going to do.
Hmm. In terms of changes in your practice, can you tell me a little bit about what's going to be different for you and your team as you treat patients going forward?
Sure. The biggest amount of time I've spent with dentistry when I haven't been doing anything clinically in this time has been consideration of the protocols. I've done more reading about infectious disease and viruses and masks and pandemics and infection control than I've ever gone over before in my life. And so we're obviously going to change a lot as far as how we bring patients into the practice. In fact, that might be something that we could sort of add to this video, maybe is kind of the listing of my protocols for that, because it's a fairly long list.
Hmm.
But when we go back clinically, the clinical staff, I spent 96 hours, 4 days, developing the clinical protocols. And in a nutshell, the clinical protocols are going to be N95 masks. There will be face shields that allow for magnification. Gowns, I chose to go with reusable gowns that can be laundered as opposed to disposables. We're also going to go with some type of either a rubber dam or intraoral vacuum system, such as Mr. Thirsty from Zerk, or the Isolite system. And then we also have an extraoral vacuum system that I've created that is going to go right next to the patient's face to kind of get anything that might escape the oral cavity. So we've got quite a
Hmm.
long list of things that have changed. We've never done any of that before.
Hmm. Do you have a plan to communicate about all of these changes to your patients, and kind of how do you expect them to react to some of these new procedures and new personal protective equipment that you and your team will be wearing?
Yes, we are clients of Weave, and one of the great things that Weave does that allows us to reach out and contact our patients via email or text messaging, which is really what people want. There's a small percentage of people now that want direct mail, but those folks are really, my mom and dad's age, and most people want it electronically. The majority of people want it in some kind of a text message. This, unfortunately, is just such a large piece of data that we're going to have to send an email and probably provide a text message that then has a link that goes to the email. But I want people to understand that the whole point of this is twofold. It's number one, to keep the patients as safe as we can possibly keep them. And also the same applies to the team, to keep the team as safe as we can possibly keep them. And I think people get that. We see more and more people, at least, I'm in the Midwest, I'm in Kansas City, and we're seeing lots of people just in masks when you're out and about now. So I think people understand that this is sort of, at least for the foreseeable future, the new normal, and it may be the new normal forever, but I think people will be very accepting of it.
Hmm. In terms of some of the changes to what you're going to be wearing to protect you and your staff during treatment, face shields have been around for a while, but they're not exactly, everyday wear for most dental practitioners up until this point. Have you ever practiced with a face shield, and have there been challenges adapting to some of this new PPE?
It's interesting, for as many things as I've worked with and tinkered with in my career, I've never worked with a face shield. I do have some concerns about all of this, and I think, I wish I could get my hands on them early. I don't know. I've ordered all the PPE, and I've been assured that it will all come in the week before we open. We plan on going live with patients on May 18th. And I've been assured that all the PPE will be there by the 15th at the latest, but that doesn't give us a lot of time to experiment with them. I went with the OptiOp system for the face shield, based mainly on the fact that it does allow for magnification. They've got enough space there. On their website, they have a nice picture of either a dental assistant, a doctor, or a hygienist, wearing the shield. And they have what looks to be probably 2.5x magnification on with the shield, and it works fine. I do have some concerns on the fact that I work at 5.5, and that makes the telescope significantly longer. Are they going to fit under there? I don't know. I hope so. The other thing that I'm concerned with is the profession. By and large, we're all working with auxiliary lighting now. We've got nose lights, and we don't use a lot of track lights. In my office, trying to think, I know in the two operatories that I work mainly out of, there are no track lights. In one of the hygiene ops, we don't have a track light. I'm trying to think, when I built my new office, I had a 3-operatory office at the time, and we moved to a 7-op office. And I brought the track lights I owned with me, mainly because I didn't want to leave them. Dentists hate to waste money. And I thought, I just hate to leave those hanging from the ceiling. But we don't use them anymore. So I don't know what it's going to be like to have that light shining into that shield. We've all taken, probably at night, a flashlight and tried to look out the window with a flashlight, and you see that the majority of the light is reflected back into your own eyes, and not much of it goes to the outside. I don't know if we're going to be faced with that same situation in dentistry when we go to these face shields. I have a suspicion that there's going to be something we're going to have to do to get used to either changing the angulation or something to make that work, because I do think that's going to be a problem.
Mm-hmm. In terms of other things in getting ready for opening the practice again to every type of appointment, there have been lots of coverage of PPE and other supply shortages out there. Have there been logistical challenges to getting your practice ready to see a more full schedule of patients again?
It's been a nightmare. One of the things I've learned is that the disposable gown market, for instance, it doesn't take, from what I understand, it doesn't take very much to switch over the factories that make disposable gowns to switch them and have them make masks. And when the mask shortage happened, everybody, there was so much in the news about, oh my gosh, there are no masks. So a lot of these gown manufacturers said, quick, let's switch over and make masks. That's where the demand is. That the people need the masks. But unfortunately, that's created is now a supply deficit of disposable gowns. That's one of the reasons that I went with reusable, was simply that the disposable gowns are much harder to get. I do have some. I have about 150 disposable gowns, but those are backups. And those were in my office, a lot of them before this all started. So we've got that as a problem. The KN95s have been a problem. Face shields are actually kind of hard to come by as well. I was lucky to get my order in for these intraoral vac systems before this really hit, as far as recommendations began to come out suggesting them. So I think now those are kind of in short supply. It's almost interesting how everything you need is in short supply, even so much as the plexiglass pieces that we purchased for the front desk to provide some separation between admin and patient. Even those were harder to come by than you would have thought, and those are just big pieces of clear plastic. But the demand has been so great for all of this that and then the flip side, of course, is going to be that, especially in the mask market, we are desperate for masks right now, just in healthcare in general, worldwide. And all of the factories have ramped back up now to increase production. And probably late June, mid-July, we're going to suddenly see a mask glut. And the price of masks has gone way up. I mean, I had one company contact me that told me they could get me N95 masks for only $10 a mask about a month ago. But now you're going to see that go up, and then it's going to come crashing back down as we get a glut of some of these products on the market. And it's going to be interesting because people are going to try and time their buying to match. I think, I don't want to spend too much, but I don't want to have too few. So there's this whole balancing act that offices are going to do in trying to procure these things.
Mm-hmm. Now, when you mentioned, using Weave to stay in touch with your patients via text and email and other things, one other technology that has come to the fore during the past month in the dental space seems to be teledentistry platforms. They've just exploded with new offerings out there. And I'm wondering, have you had the chance to use any of these systems at all during this time?
Yes, I've been working with Teledent. And for those of you that haven't heard of it, if you're familiar with the mouthwatch camera, which is the really incredibly great imaged camera for the incredibly low price, they also have a teledentistry arm called Teledent. And I am a client of theirs. We haven't had a tremendous amount of usage of it yet, but I certainly see this becoming more of a thing as we move forward. One other thing I'll say about teledentistry as well, Noah, is we are right now riding on the very tip of a tsunami of older patients that are no longer going to be mobile. My father, in the past year, went into a skilled nursing facility, a nursing home, and nobody checks on those people from an oral health standpoint. We are turning over people into the older category, 65 and older. I think it's like 10 or 15,000 people a day in the United States turn 65, and that's a huge number. And we need to take care of those folks. And those folks aren't going to be, driving to their appointments. It's expensive for those people to have to be transported to their appointments if they have to use some type of transportation provided by their nursing facility. So even after the COVID-19 peak has passed, I still think there's going to be a tremendous demand for teledentistry to help these folks, because these people need to be treated. They deserve it. And we as healthcare providers, that's our mission. We need to take care of those that can't take care of themselves. And so that's a really big deal for the future, even after 19 ends.
Mm-hmm. And, with that thought on things that are changing in the industry and technologies that are coming to the fore, are the types of PPE changes that you're making to reopen things you see as, kind of a new normal where this industry is going to go going forward? Are we going to see new infection control approaches and technologies and just more, I guess, pre-screening of patients?
I think yes. I'm hoping that we see some changes, but I'm hoping also that we don't see the drastic changes that we're having to put in place currently. What I'm hoping is that we come in with this, with all of these changes in place, and then as we realize that we're past the curve, that things are flattening out, that there isn't a new virus on the horizon, that maybe we can dial some of this back. And there's a couple of reasons for that. Number one, all this gear, it's hot and it's heavy. And it's really uncomfortable. As I told you earlier, I don't have a face shield currently. So I've been seeing patients with an N95 and then my normal setup of glasses. And wearing an N95 mask is akin to putting a terry cloth wash towel around your face. They're ridiculously hot. When I take the masks off, you can actually see sweat beat it up on my skin. And I'm sure some of it's probably just moisture from respiration as well. But they are really, really hot. I sweat, in my scrubs wearing one of these masks. So I can imagine that when I've got a gown on that is waterproof and doesn't vent, I have this N95 mask on. I have this face shield that is once again pocketing more heat. And gloves, obviously. We're going to be really uncomfortable as providers, number one. And I would tell females in the field, either plan on not much makeup or plan on investing in waterproof makeup, because your face is going to get damp. And the other thing is, this isn't an inexpensive thing to have to come up with. If you raise a crown fee $15 or an endo fee $15, most people don't even really pay attention to that. But if you raise a pro fee $15, that's the thing that people see the most frequently, and that's also going to be a much greater percentage of the fee that you raise than it is on higher dollar procedures. And I don't know who's going to pay for that. Are insurance companies going to jump up and say, oh, out of the goodness of our hearts, we're going to pay an infection control fee? I doubt it. Patients are probably going to have to, at least in the short term, come up with this out of pocket, and it's going to be expensive, and it's going to be tough for them to absorb. And that's one of the reasons I'm hoping that we can dial some of this back at some point. And, perhaps we stay in N95s for in perpetuity, but maybe we don't then need the face shields and the gowns. I don't know, but every time you add something, you add costs. And that's just part of the equation, unfortunately. And dentists, we need to stay in business, so we can't help people. So that's a tough question to answer as far as who pays for this and, how much of these costs are there. But I can tell you from looking at what I'm paying for some of these things, some of these changes in protocols are not cheap. And I don't really know where we go from here as far as that is.
Mm-hmm. Now, a lot of the practices that I've seen and people I've spoken with about getting ready to reopen, in some states there are still regulations prohibiting certain procedures. Some practices are looking to limit the procedures they do to reduce aerosol production in their practice. Are you taking any of that approach when you reopen, or are you going to be offering the full range of treatments you offered before?
Well, I'll cover this in a couple of different angles. Number one is personally, no, we're going at it and we are going to treat people the way, I don't want to say the way we've always treated them because that makes it sound like I'm ignoring the protocols, but I'm not going to change my treatments on patients. I'm not going to suddenly not do aerosols because of this. The reason for that is people deserve the best that we can do. And I have a tremendous respect for the people in the military. And one of the reasons I do is that even if you're an accountant in the military, when you sign up, you guarantee that you will give your life. You'll pick up a gun and shoot or be shot at. And that's part of the risk of what you do. And that's why I admire them so much, is that everybody says, I promise I'll put my life on the line if need be. That's how I look at what I do in a way, is when I signed up to be a dentist, I didn't sign up to be a dentist only if there's profit involved, or only if it's not risky, or only if it's, you know, a cold, dreary day and I can't go outside. I signed up for this to help people, to do my best, to keep my fellow man out of pain, free of infection, and to increase their quality of life. And if I have to put myself at risk to do that, so be it. That's the job I signed up for. If I don't want to do that, the way I look at it is close your office, sell your office, and find another career. Otherwise, there's going to be risks. The second piece of my answer will be that there is no such thing as a 100% guarantee. You can't plot for everything. I can't plan with a big bubble over my office that deflects meteorites in case a meteor falls out of the sky and comes through the roof and hits me in the head and kills me. You can't plan for all of those. So you plan for the best you can, and you do the best you can. One of the things that I want my peers to be aware of in this is that this current time in dentistry reminds me a bit of when the HIPAA laws were coming along and first coming into enforcement. There were a lot of companies that were, you know, kind of fly-by-night, snake oil sales that would come in and tell you that you absolutely had to buy this product, you know, that they paid $5 for, and they were going to charge you $25,000 for it. And if you don't have this product, you're going to be subject to hundreds of thousands of dollars of federal fines, and you're going to lose your license. And they preyed on the fear and the lack of understanding of people at the time, because nobody really knew what the rules were going to be. And there are a lot of things out there like that now. Tyvek jumpsuits, you know, with the hood, the whole hazmat suit, that are incredibly expensive, that people are wanting to sell you. I've seen companies that are selling lights that, you know, have a UV spectrum to them, and they kill airborne pathogens. There's been systems that folks are selling that are very high filtration, that, you know, filter all of the air in your clinic and, you know, remove all the harmful things from the air. And I'm not saying that the UV and the filtration doesn't work, but what is the trade-off in that? You know, in the office I'm in, we have 7 operatories, and they're all in one large room separated by cabinetry. But let's say that I was in an office where I had an individual treatment room, for instance. Am I going to say, okay, Mrs. Jones, we're done creating aerosols. Now the filtration system takes an hour to recycle the air in this room, and we can't open the door because that will let some of the contaminants out. So we're just going to sit here and watch CNN on the flat screen for 60 minutes while the air is recirculated and the pathogens are removed. I don't think that's practical. And for sure, the UV light is going to be the same way. It needs to be, the air needs to be exposed to that wavelength for a certain amount of time to kill all of those bugs. So are we going to stop and, see a patient in the morning and have that patient stay in the office for the entire time while the lights work, and then another patient in the afternoon? You can't do that. You can't do that and treat the number of patients that you need to treat. So I would just encourage my peers to be careful and to do their homework and their research to know what they really want to do and the science behind it to make sure it works, and also that it's practical. Because if something works but it takes 100 years to be effective, that's not practical in our environment.
Mm-hmm. Well, Dr. Flucke, we really appreciate you joining us here today. We're out of time for this segment, but we'll definitely delve into these topics again in the future. Stay safe, and thanks again for all you're doing.
Thanks. Noah, it's always great to talk to you. Stay safe, be well.